Hello, gentlemen. Dr. Jose, what are the warning signs or symptoms of mitral valve disease?
So, sadly, mitral valve disease can be an insidious disease, can be a silent disease for many years. So it's a disease that has a very long preclinical phase, meaning the patient already has the disease but still shows absolutely no signs. And that's why it's crucial an early diagnosis, because in a lot of situations when this disease is caught, due to the presence of clinical signs, it's already quite late, and what we can do is a bit more limited. The ideal diagnosis is done during a routine veterinary appointment by the detection of a heart murmur on auscultation. A heart murmur is an abnormal heart sound that's picked up during routine appointments when listening to the heart with a stethoscope, and whenever a veterinarian detects a heart murmur on auscultation of a dog or a cat, he should direct that patient for further investigation by a cardiologist. The signs itself, the clinical signs or symptoms of mitral valve disease, are those of exercise intolerance, of lethargy. It's a patient that struggles to breathe, who breathe faster and with more efforts. Historically, for many years, we thought that cough was a typical sign of heart disease. That's been debunked, so a lot of patients are referred for cardiology appointments because they cough. And it can still be a sign of heart disease, but usually just in very advanced stages. It's just very common that patients with mitral valve disease simultaneously also have respiratory disease, and thus they cough.
Dr. Matsuro, what are your criteria for selecting ideal candidates for this surgery? Are you considering breed, age, the severity of the MVD?
Yeah, so good candidates are patients who are expected to develop heart failure in near future, and Jose will find that.
Yeah.
And it's difficult to find by the owner. And patients who have recently developed heart failure is also a good candidate.
Okay.
Yeah.
Oh.
And in medical terms, these are stage B2 and stage C mitral valve disease cases.
Okay.
Yeah. And breeds that frequently experience the progression of this disease is including Cavalier, King Charles Spaniels, and Chihuahuas, and other small breed dogs.
Okay. And how do you manage complications unique to mitral valve repair surgeries? What strategies have you developed to minimize risks during and after the procedures?
Major complications are bleeding and kidney failure, heart failure, and everything. Every organ can affect this surgery. So we're using anti-clot medications and heart medications and anesthetic and sedations, everything to minimize the risk of any complications. And this hospital have a very good care team and anesthesiologists and intensivists and cardiologists.
So, Dr. Jose, are there any medications, diet, or supplements that can help support the patient's cardiac function?
That's a tricky question. In terms of patients that do not have disease, there's not much that can be done, because specifically mitral valve disease and the vast majority of acquired heart conditions in dogs, they tend to be genetically determined. So unfortunately, there's not a lot that we can do. Some studies suggest that diets rich in essential fatty acids have some cardiac protective effects, omega-3, omega-6, but that's about it. Sadly, there's no medication to prevent the development of heart disease. On the contrary, when heart disease is diagnosed, yes, there's a lot that can be done, and thus the importance of an early diagnosis. So there was a study done a few years ago that showed that with an early diagnosis and prompt treatment, we can extend the survival of a patient and delay disease progression by more than 60%, which is tremendous. So we can afford that patient, even without surgery, several more months, sometimes even years of good quality of life if we diagnose the disease early and treat it promptly. There's the importance of an early diagnosis, and that's why it's crucial, vital to refer every patient with a heart murmur for an immediate cardiac assessment. Later on, when the disease already starts showing clinical signs, the treatment is mostly palliative, so it's directed at addressing those clinical signs. The clinical signs from mitral valve disease arise from what we call pulmonary congestion. So the patients start accumulating fluid in their lungs, which makes it harder to breathe and causes the exercise intolerance and sometimes eventually the cough. So treatment is mostly targeted at reducing those liquids, that fluid accumulation in the lungs. So we treat them with diuretics and medication that help prevent fluid accumulation. But again, this is only palliative. We're not really addressing the cause of the problem. We're just treating the clinical signs. And sadly, the medication to treat heart disease can cause kidney disease, can cause kidney failure. So it's very difficult to manage heart disease in the long run because eventually we risk kidney failure. Diet-wise, so far there hasn't been any study proving that diet A, B or C is more beneficial for patients with heart disease. We suggest, or some people suggest, a moderate sodium restriction, although I personally feel that it's important that the patients eat, because one of the most common complications with heart disease is also weight loss. With time, they start losing weight and becoming fragile. So it's important to help them maintain a good body condition, and thus a palatable diet, something they enjoy eating, is fundamental.
So, Dr. Matsuro, what can I expect during my dog's recovery after surgery, and how can I best support them?
Yeah. So we will keep your dog asleep until the next morning after surgery to make patient monitoring easy and minimize pain. And next day after surgery, your dog can walk and eat and drink. And the following day, your dog will get more energy and over time. And 5 minutes gentle walk is allowed until 2 weeks recheck. And typically, your dog will be free from any heart medications after 2 weeks recheck. And after 3 months from surgery, any activity is allowed.
Dr. Matsuro, what are the most promising future directions or advancements in veterinary cardiac surgery?
Yeah, in the distant future, it might be possible to cure heart disease with minimally invasive treatment or just medicines. But for now, too many small lives are lost due to heart failure every day. My goal in near future is to spread this technique to all over the world and get more available to the patients.
Well, I'm glad you started with us. Thank you.